This video will be covering anatomical terminology that you should be familiar with when you're learning anatomy in medical school. We'll start by discussing anatomical position, then move on to anatomical planes, anatomical terms of movement, anatomical terms of location, the references that we used for this teaching session, and how to contact anatomy in the future. First, we have anatomical position. So this is the standard position that you will see subjects in when you're learning anatomy. And what anatomical position means is that the subject will be facing forward with their arms to their sides and their palms facing outwards. Like I said, this is considered the standard position and it's something that we use to compare different things to. The next thing important to know about is the anatomical planes. These will be referred to frequently throughout your teaching, and there are 3 planes: coronal, sagittal and transverse. The coronal plane divides the body into the front and back sections, so that's anterior and posterior. The medial sagittal plane divides the body into equal halves down the middle. And the transverse plane is a horizontal plane that divides the body into equal halves through the middle into upper and lower regions, so superior and inferior. You may come across these planes when you are looking at CT scans. The next thing to be familiar with are the anatomical terms of movement. So common ones that you'll see are flexion and extension. Pronation and supination is a movement specific to the arm. Inversion and eversion is a movement specific to the ankle and foot. Abduction and adduction, and then here we've got neck lateral flexion too. You'll also see rotation, which can be internal or external, and that's usually referring to the shoulder joints and the hip joints. So medial and lateral rotation is rotation towards and away from the midline. Elevation and depression is movements in the superior and inferior direction, for example, when you're shrugging your shoulders. Flexion decreases the angle between 2 parts of the body, and extension increases the angle between 2 parts of the body. Abduction is movement away from the midline, and adduction is movement towards the midline. So I remember this as you are adding to the body when you adduct. Like I said, pronation is a movement specific to the arm, and it's when you turn your hand to be palm down in the prone position, hence the name pronation. And supination is where you turn the hand to be palm up in the supine position. Dorsiflexion and plantarflexion are movements specific to the foot. Dorsiflexion is flexing the ankle so the foot points superiorly, and plantarflexion is extending the ankle so that the foot is pointing inferiorly. Inversion is where you move the sole of the foot in the medial direction. So, for example, if you roll your ankle, you're usually inverting it. And eversion is moving the sole of the foot in the lateral direction. And finally, you have opposition and reposition, which is bringing the thumb and little finger together and bringing the thumb and the little finger away from each other to their resting positions. Next, you have your anatomical terms of location. So we've kind of already covered these a little bit. So proximal means anything kind of closest to the head, and distal is anything away from the head. So the shoulder is more proximal than the fingers are. So your fingers would be described as distal. Lateral is anything away from the midline, and medial is anything towards the midline or the midline. And then superior is anything towards the head, and inferior is anything towards the feet. Posterior is anything on the back side of the body, and anterior is anything on the front side of the body. I hope that's been useful for you. Here you can see the references that we've used, and they're great if you do want to dive a little bit deeper into some of these terms. But I hope this is giving you a brief overview of some of the terminology you should expect to use in your anatomical teaching.